Reducing the excess fat around midsection or waist is extremely important as it is very dangerous for heart. As your waistline expands, so does your risk of cardiovascular disease. Visceral fat is another name of belly fat. Visceral fat turns out to be very different from the fat that accumulates in hips or thighs. So there is a lot of empty space, so visceral fat pads into that. When these fat cells break down, they shower the portal vein. So portal vein is a vein, is a blood column which carries the blood from the intestinal area to the liver. So this showering leads to lipotoxicity. Lipotoxicity affects the nearby pancreas, hampering its ability to produce insulin. So insulin is a hormone that carries glucose into the body cells. Now it also promotes insulin resistance, in which the body's muscle and liver cells don't respond adequately to normal levels of insulin. As a result, the blood sugar levels rise. They sharply go up, boosting the risk of type 2 diabetes mellitus. In addition, when these misplaced fat cells die, cells that serve as a cleanup crew release inflammatory substances called cytokines. So cytokines are the one reason people develop atherosclerosis. Cytokines are inflammatory mediators which lead to atherosclerosis, the underlying cause of cardiovascular disease. So how to control? I think this is the question which we are looking at. While there is no magical formula for losing the belly fat or decreasing the belly fat, a reduced carbohydrate diet can be helpful. Just stay away from those that quickly spike your blood sugar levels and encourage your body to store fat. These three sources are the major culprits. Sugars, obviously, anything made with added sugar like cookies, cakes, pastries, ice creams, soft drinks, canned juices, white flour. The most commonly consumed examples and the worst offenders, the P's and B's, So P's for pastas and pizzas and B for mainly bread. So these are again to be restricted heavily. Starchy foods. I always tell to all patients, white potatoes and rice to be restricted. These are again the starchy foods which lead to sharp rise in blood sugar levels. Intermittent fasting or time restricted eating may also help improving your body's insulin response and reduce visceral fat. So the basic idea is to limit your food intake to a shorter than normal time frame. For instance, you might eat only between the hours of 8 a.m. to 2 p.m. and then fast, until the next morning. So have intermittent fasting intervals or abstain from eating for at least 14 hours after the last meal of your day. Do this 3 days per week and then eat on your normal schedule for the other 4 days. So this is some of the advices, some of the tips which you can follow. And don't forget to do a regular exercise. Both aerobic and muscle strengthening exercise are very important, which can help you burn extra calories